This fungi, Mucormycosis, practically affects all parts of our body, primarily the sinuses, or this part where we have our sinuses, but it can affect the lungs, the brain, the kidneys, the skin, the gut, etc. But in this post-COVID times, most of the cases who are presenting to us are sino-orbital diseases or disease, which means that it primarily affects the sinuses, and from the sinuses it is transversing itself or traveling itself to the orbit. Now, what is orbit? Orbit is a space where a bony cavity in which the eyeball and these tissues around the eyeball are placed. So it affects the sinuses, and from sinuses it is traveling to the orbit, backwards toward the optic nerve, where the optic nerve is the nerve which makes us see, and then to the brain. So depending upon when the patient is presenting, at what severity, we are seeing the cases as form of sino-cerebral orbital diseases. Now, ironically, this fungus has been labeled as black fungus amongst all the social media marketing, because it's a very easy terminology to call it as black fungus. But this fungi or fungus itself is not black. It is the group of white fungi. Now, what it does is it devitalizes the tissue or eats the tissue or makes it so necrotic that we form a black eschar or a black necrosed tissue wherever it has attacked and killed the tissue. And that's what is black in color. But the fungi itself is white, and it is not the black fungus. Black fungus is a separate group of fungi which thrives on melanin. And this is not the fungi which thrives on melanin. So a word of caution for the physicians who have not seen it before, or for the patients who are learning a lot of things from the social media, is don't look out for the black spots, because if you have seen the black spot or the black tissue, that is the end stage of the disease, or the disease has actually progressed pretty to the advanced stage. So the symptoms which you have to look for are not the black spots, but the symptoms are usually after post-COVID, practically between 10 to 20 days of COVID. Recovery is, toothache, facial swelling, mainly in this area, numbness starting from the eye to the corner of the nose, upper molar teeth, or the upper lip, and this area. Sometimes the patients can have a browny discharge from the nose. If it has affected the orbit, the patient can have lid swelling, painful movements of the eye, double vision, and in advanced cases, no movement of the eye at all with the droopiness of the lid. Now, this can be accompanied with or without headache. So most of the patients can even have a chronic headache or a headache lasting for many days, and they keep treating themselves with only the painkillers. So if you have been a COVID patient who has recovered from COVID, has been on steroid therapy, has been a patient of diabetes, or have developed diabetes during the process of your treatment, please look out for these warning signs. Please don't wait to see the black spots. Now, for the convenience sake, it has been called as black fungi, but most of the microbiologists and the specialists would agree that Mucormycosis is not a black fungi. It is a group of molds or mucormycetes, which is actually a group of white fungi. So it's just the way the fungus behaves and reacts in the tissue to produce that black tissue.